and learning about. Our next guest has, for the last few years, been developing a study that helps children to overcome dental anxiety. So please welcome onto the show Dr. Abeer Al-Namankany.
Assalamu wa rahmatullah. Sister, you know what? I wish you were around when I was younger, to be very frank. Let us just quickly ask you, we're going to go for a break in a few minutes. Just tell us a bit about your background, how you've been involved in this particular field, and then maybe after the break we're going to touch on why you thought about developing this particular system.
Yeah. First of all, thank you very much for the invitation for this nice show.
It's our pleasure.
It's 8 years now. I'm studying about pediatric dentistry. And then over the last 4 years for my PhD, I developed a new cognitive dental anxiety measures, which been recognized as a gold standard and accepted from American Society of Pediatric Dentistry. This measure is helping the dentist and helping the child as well to measure the dental anxiety score. So by scoring the child dental anxiety level, then you can manage and write a treatment plan for his phobia. The nice thing about my method is it's treating the dental phobia using drug-free psychotherapy methods.
I noticed that. So it's not about sedation, is it? Because obviously that's the first thing we try to do, isn't it? If a child doesn't want to go and see the dentist, or if somebody's got a fear, we say, can you sedate us, please? And we don't know what's going on.
I couldn't deal with that now, let alone being a child.
Yeah.
Unfortunately, this is the reality. This is what's happening at the moment. As soon as the child refuses to open his mouth or scared, they transfer the child, not only for sedation, but more dangerous than this is the general anesthesia. And general anesthesia, you know, I don't really recommend the use of general anesthesia or even sedation, just because the child is scared.
Well, sister, we are going to come back to you just after our break to find out a little bit more about that. I've got a little girl who won't go to the dentist, so I'm very keen to know. We'll also be coming back with our CEO, Brother Muhammad Ali, and with our winner of the NQC competition. See you just after the break. Assalamu alaikum and welcome back to the final part of Living the Life, our very first show of this brand new series exclusively on Islam Channel. Now, just before the break, we were speaking with Dr. Namankany. I got it right?
Yes.
Yes. And I was telling you, I've got a 4-year-old daughter and she will not go to the dentist. Now, I've got 5 children. She's the youngest of 5. The other 4 have got no problem, but she won't go. And I know there's no point in me taking her to the dentist, because if I take her there, she won't open her mouth. So what can I start doing at home as a parent to start, as you said, using these psychological techniques to get her used to the idea of going to the dentist?
Try always to talk about positive experience. Don't ever talk about your previous negative experience in front of your children. Try to show them books or YouTube clips about dental clinic, about what the dentist is going to do. Try to tell her a good story about your dentist will be very nice, the staff will be very friendly, and you will see this by yourself, to convince her, and then tell her about what's the benefit, why she needs to go and see the dentist.
I mean, before we actually came on live, you were showing some of the awards that you've won. So how successful has your treatment been?
Alhamdulillah, I've been awarded 5 international awards so far.
MashaAllah.
The most recent one is by the Royal College of Physicians and Surgeons in Glasgow and the British Society of Pediatric Dentistry.
If it's from Glasgow, it must mean a lot. Without a doubt.
He's from Glasgow, you see, that's why he says that.
Thank you. And also the nice thing, recently one of my research published in British Dental Journal, and it's been accepted as a practice for continuing professional development for all dentists in the UK. It's a unique study because it's the first study in this speciality.
Right. So what's your hope from this work? I mean, do you hope that one day children will all be treated without sedation? Do you hope that we'll all change the way we see the dentist? What is it that you envisage for the future?
What I'm going to do next now, I will start to raise the awareness among dentists and parents and children about it's very important to treat the phobia using psychotherapy methods, because when you use sedation or general anesthesia, this is not going to treat the phobia at all. This is just will allow the dentist to do his treatment in a quicker times, and also it will affect the patient. At the end, if we keep saying sedation is safe, at the end it's a drug.
Okay.
And plus this difficult economic time, if we use drug-free methods, then how much we will save for the NHS? I know it's difficult, but everything is start difficult. Even if I couldn't do anything while I'm still in this life, I hope that I can open the door for the people.
Finally, before you go, very quickly, can you just tell us where we can find more information about your treatment?
There is a medical database, PubMed. I have published research in PubMed.
PubMed. We'll have those details for our viewers on our website.
Google me.
Google you, inshallah. Jazakallah khair. Dr. Abeer, thank you very much. May Allah reward you, and I'm sure many children are making dua for you, alhamdulillah.
Alhamdulillah, I'm sure
they are.